Hello, dear homeopaths. This is Barbara Liberowicz, Homeo Sapiens. My guest today, very special guest today.
Today we want to talk about the study we have performed at the Medical University of Vienna.
Hello, dear friends, homeopaths. My name is Barbara Liberowicz. This is Homeo Sapiens. And my guest today is Dr.
Thank you for your invitation, and it is our pleasure to be here with all of you.
Hello, dear friends, homeopaths. This is Barbara Liberowicz, Homeo Sapiens. And tonight I have two guests.
There's magic about homeopathy itself. I feel homeopathy by itself is a magic. So each remedy is, it's a magic world.
And number 3, very important things, homeopathic doctors don't require stethoscope.
Require.
Patients with additive homeopathy had a significant higher level of quality of life.
Wow.
And surprisingly for us all, also the survival was much better. So the patients with additive homeopathy lived for 6 months longer than the other ones.
And frankly, I think the vets often make better homeopaths than us, than if I were to actually say anything. And it's much easier to love animals than it is to love human beings.
This is the perfect moment to ask him about homeopathy in Mumbai. Because, this is like the second capital of homeopathy now in the world. It's very busy.
Is it?
Lot things are happening here.
Which one is the first?
Yeah, this was a good question. As I understand, children from homeopathic group could receive conventional treatment support if necessary.
Yes, we were concerned about ethical considerations that someone might say, you endanger children. So we allowed homeopathic medical treatment, conventional medical treatment for children in the homeopathic group if a doctor, pediatrician identified any risk to health or safety.
And the poor children from conventional arm could not receive acute homeopathy, just in case.
Not within the trial.
So many good doctors in our hospital. The neurosurgeon, he used to take me with him when he used to go for the rounds. Post-operative, after operating on some patient for glioblastoma multiforme, the patient was unable to open eyes. And then the way patient was lying and snoring and everything, I prescribed opium, and he woke up.
But Kent has always been the influencer of homeopathy, at least in the last years, last century rather, because after Kent, there has been a shift in, the way homeopaths started understanding not only case taking, but even prescribing.
And when we've been thinking about translating Organon into Polish, what was the meaning of the title? Firstly, it was Organon of Medicine, but at the very end, it was Heilkunst. It means for me much more than just medicine.
What was the part of New German medicine that helped you to find the right remedy?
So there was, he was from a village, was not ready to talk much, right? If I have to do a case history, I cannot talk or converse much. So the leprosy is the dermis and the conflict is attack conflict. So I straight away asked him, who attacks you verbally? He said, my wife. I asked, what does she do? What does she do? She abuses me. She insults me.
Cephisigra is out and out syphilitic. They may hold on to something, and even the most expensive phone they will throw. And that is how you get the prescription. So most of our prescriptions are based on integrative, holistic way, but sometimes a keynote which is so strong can help us to prescribe a right medicine.
What would be the differential diagnosis between lachesis, vipera, and crotalus?
With lachesis, varicose veins, it would be left-sided. Patient will also have hematose. That's almost always there with lachesis. and the pain is better, warmth. The varicose veins are very blue, etc. With Vitera, the main distinguishing factor is that that patient will walk in and immediately lift up their leg, because from the moment of leaving the car, sitting in the car was painful, because their leg is dependent, their leg is on the floor. Walking in, coming to sit, the pain will be terrible. Then that patient will immediately lift up their leg. Say, oh, why do you lift up your leg? It eases the pain.
And everything was disturbance of bile. And even if you read Nicole Culpeper's literature on chelidonium, he also talks about it is a remedy for black bile, not yellow bile. If you ask me what is black bile, what is yellow bile, is it unconjugated or conjugated bilirubin, I really don't know.
Were you surprised with the outcome of this, with the results, or you were disappointed? What was your reaction when you saw statistical results first?
We were struck. We were very surprised. This trial was small because of the limited funding we had. We had very limited funding available to us for this trial, and so we were able to get a minimum of 100 children. We expected to see only a trend. We did not expect at all anything significant, but the results that you saw are highly significant, even with a small trial. It's really, I think, thunderstruck by that.
Science, rests on doubters. Hahnemann doubted Cullen's Materia Medica, and that is why this science came around. So science generally needs more doubters. The change that I have seen recently is this, that in homeopathy we have more believers and followers rather than doubters. Now that creates a situation where people believe that whatever has been told to them is correct. So I feel that homeopathy has gone from being a science to becoming a religion.
Homeopathic doctors practicing in villages where there are no things are available, like investigation, other things. There is where the acumen of a physician counts. You see, how you observe, what symptoms are there, signs are there, what diagnosis is there.
So whenever it doesn't have a real concept or reference,
咁呢種創造咧就會發生啦。
then it hallucinates.
所以咧，我哋真係要好小心，要提防呢啲漂亮嘅美麗嘅說謊者。
So we have to be really careful of this beautiful liar.
You tell her about your complaint. What complaints you have?
I have stiffness in my legs and drop legs and tightness in both legs and back, weak. And now I can walk.
The Materia Medica data, we have sometimes very good references. We know what Hahnemann did. We know how Hahnemann conducted his provings. We have references to poisonings and also to clinical cases. I think the Materia Medica isn't that bad.
Almost nobody is happy with repertories we have. So what is the solution?
Perhaps the solution is to do a new repertory from scratch.
Professor Frost, what is your message for homeopaths about ICU patients?
I just encourage you to try. It's not difficult, it's easy, and it may help significantly.
So, Mr. Astrologer, what is, according to you, the telling for homeopathy? What is the future of homeopathy? What is written in the stars?
I can say that Samuel Hahnemann had the sun in Aries. He was born April 10th. And the ascendant was in the middle of Sagittarius. And the planet, which was exactly rising at his time of birth, which was midnight, was Pluto. And Pluto is death and being reborn again. So I consider that homeopathy, even if many enemies, many detractors,
particularly during our times are so active, homeopathy will never die.